Sure. So I started using the Octave test about a year ago in my clinic. I work at an academic center as the only MS specialist, so we are a little bit limited at times in some of our offerings, just in general as MS specialists, with MRI and clinical exam being some of the only tools. So the availability of a commercial serum biomarker test was a really attractive option because it's something patients have been asking for and previously unavailable. So the purpose of the project was to kind of retrospectively review my first year of using the test and define the patient population, their levels of disease activity, demographics, how long they've been on treatment, what therapies they've been on, and to characterize their average scores on the test. A lot of the questions people may ask is, when should you use a serum biomarker test in MS? And that was one of the big questions I had too, starting out, because we don't really know. So I found a lot of scenarios that it was useful, particularly for newly diagnosed patients who are newly started on treatment, kind of getting a baseline score, and that's something you can follow over time. What I tended to find was that I did about 90 patients, 90 samples. About 13% of the patients had what we call a high score, meaning they have an elevated risk of gadolinium-enhancing lesions on the MRI. And that equated to 12 patients, and essentially all 12 of the patients had either true radiographic recent disease activity or evidence of recent clinical disease activity, whether that's a relapse or other. For me, it's very important. It's a tool patients have been asking for. We're pretty limited with the MRI. Any additional information you can give a patient, because these are patients who have a lifelong inflammatory neurodegenerative disease, and any additional information they can get on their level of disease activity that they crave. I had anytime I brought it up to a patient, this is a new test we have, they were 100% ready to do it. Right. I think it's a new objective tool for therapeutic monitoring that goes beyond the MRI. More easily accessible in some cases to patients because it's a blood test. You don't necessarily have to pre-cert an MRI and wait 3 or 4 weeks to get it done. You can get it done right there in the clinic. It gives you additional information just besides the MRI, information you may not have been expecting to get. Potentially using it every 6 months in conjunction with an MRI, alternating every 6 months, that could kind of give you an additional window into a patient's level of disease activity. Right. So I do work in South Alabama, which is an area with a diverse patient population relative to most clinical studies that have been done in MS, and this test was validated in a kind of a typical MS patient population, which is typically high majority Caucasian patients. And I work with a very diverse group of patients from different racial backgrounds in my clinic, and just demonstrating the utility of the test in a patient population like that, I think, was very helpful. Having a tool like this that's just so readily available now in clinic, it's a serum biomarker, gives you good objective information. I think it's still to be determined when is the best time to use this test. I think we're going to have a good sense of when that is, for defining patients at time point A and time point B down the road. But having that information versus not having that information, I would rather have it. In particular, we found the test to be really helpful at predicting MRI activity, like it's been previously clinically validated. But I even had some examples where the test was abnormal prior to any known disease activity. So a patient would have the test and then maybe 2 to 3 weeks later start having clinical symptoms, and then have an MRI that was showing a lot of new lesional activity. So I found it to be beneficial in scenarios like that, in patients who maybe can't have an MRI as frequently as others. Maybe a patient is allergic to gadolinium or has a pacemaker. So I found it to be helpful in different ways I didn't expect. For me, it was almost a no-brainer to try it out, because it's a blood test. We're doing therapeutic monitoring all the time on our patients, and you're getting a blood draw anyway. If you can add serum biomarkers to it in a commercially available, easily accessible test. That was, partly why we started using it. It's been a nice tool to have.